Innervision is a CT scanning joint venture between AgResearch and Palmy Farms of New Zealand. So we have a medical CT scanner that we use for measuring body composition, size of the room and all sorts of things in animals. So it's a human scanner that we're using for animals to help us with research and with animal breeding. So we scan a variety of things. For farmers, it's essentially sheep and deer. So they are the two ones that are roughly human in size, so we're able to scan them. And we would like to be able to scan cattle, but we can't fit a cow or a bull through the scanner. So sheep and deer are the two main species. For research, we've scanned a wide variety of things. So we've scanned goats. In my time, I've also scanned chickens and guinea pigs. The benefit of using a CT scanner is that it allows us to measure body composition, the amount of meat, fat, bone, the size of individual organs in a live animal. In the past, we used to have to kill the animals in order to measure that. With the CT scanner, we've got a live animal at the end, we've measured it, a very accurate result, but we've still got that animal alive so that it can go off for breeding or it can be used to get other measurements in our research program. For research, it really comes down to what are the things that the scientists are interested in. So we have measured body composition, so do we have a diet that might change that or a treatment, but we've also measured the size of the rumens for greenhouse gases. We've looked at growth of the fetus as a lamb as it's growing in the mother, and other things that we can do to improve that growth or have some impact in there. With a human application, the patient normally has something wrong with them, so the doctor wants to have a look at the image and say, here's what the problem is. With our use, we're trying to calculate how much meat, fat, bone there is, so we've had to develop our own software and systems in order to measure that. There's always been a very manual component to that. There's a lot of it that's automated, but it requires us to actually have someone sit down and say, this part is carcass, this part is non-carcass. So this is the bit that's of value to a farmer, this bit is not. So during lockdown, I had a bit of time and we've developed a machine learning algorithm that is actually able to do that. So we were able to train the software with the 25 years of images that we've got sitting in our databases to actually analyse that. Now it doesn't actually change the result for the farmer, but it's an enormous benefit for us because we're able to now do in around about 30 seconds what would take a person about 4 hours to analyse.
The Dunedin Wildlife Hospital is a veterinary facility where we only treat native New Zealand species, so just native wildlife. We treat about 600 patients a year from all across the South Island. So from time to time, the Wildlife Hospital vet team has a need to do CT scans on some of our patients. It's not something that happens every day, but it does arise a few times a year. And we've developed a collaboration with AgResearch to access the CT scanner that's located at the Innervision campus. Innervision is really close by. It won't take us long to get there. It's completely set up for scanning animals, which the current facility we use is not. It's meant for people. So I think that it will be a really, really nice fit for us. It will make things so much easier.
We were aware of the Wildlife Hospital, the extraordinary work that they do with our taonga species, and so it was a really good opportunity for a partnership, us as part of that wider Dunedin community, and then with the Wildlife Hospital to meet some of their needs. I'm really pleased at how this has turned out.